This is a tutorial on the muscles of the face, so the muscles responsible for facial expression. So these muscles are innervated by the 7th cranial nerve, the facial nerve. So when you're testing a patient's cranial nerves and you get to cranial nerve number 7, you ask them to wrinkle their forehead, to close their eyes as tightly as they can, to show you their teeth by making a smile, and asking them to puff their cheeks out. So this is a crude test of the muscles of facial expression. So the way I'm going to do this tutorial is that I'm going to start superiorly and work through the various muscle groups in the face. So the orbital muscle group, the nasal muscle group, and then the muscles in the oral region. So to begin with, looking at the most superior muscle on the face, you can see this muscle here, which is the frontal belly of the occipitofrontalis muscle. And it's called the occipitofrontalis muscle because it consists of two muscle bellies. So you've got the occipital muscle belly, so called because it's on the occipital region of the skull, and you've got the frontal belly of the occipitofrontalis. And connecting these two muscle bellies, you've got this flat tendon sheath, this aponeurosis. And if you have covered the layers of the scalp, you'll have been told that the aponeurosis of the occipitofrontalis makes up the third layer of the scalp. So you've got skin, connective tissue, aponeurosis, loose connective tissue, and then the periosteum. So the aponeurosis of the occipitofrontalis is the third layer of the scalp. So if we just look at the orbital region, we can see these muscles which surround the eye, and this muscle is called the orbicularis oculi, and it acts sort of as a sphincter of the eye. And you've got an outer part and an inner part to this muscle. So this outer part here is called the orbital part, and it's responsible for closing the eyelids forcefully. If I just zoom in a little bit more, you can see the inner part of the orbicularis oculi, and this is called the palpable part, and it resides inside the eyelid, and it's responsible for closing the eyelid gently. So that's the orbicularis oculi, this circular muscle responsible for closing the eyelids. So the next muscle is this muscle here, the corrugator supercilii, and it lies just deep to the orbicularis oculi, and it draws the eyebrows medially and downward. There are three muscles associated with the nasal muscles of the face in the nasal group. So you've got the procerus, you've got the nasalis, which consists of a transverse part and an alar part, and you've got this muscle in the midline, which is called the depressor septi nasi. So the procerus muscle here on either side originates on the nasal bone and inserts onto the skin of the forehead, and this muscle is active when an individual frowns. And these muscles here, the nasalis, which consists of the transverse part and to the alar part, is responsible for compressing and flaring the nostrils, the nares. So the transverse part compresses the nostrils, and the alar part of the nasalis helps to flare the nostrils. It opens them out. And this muscle here, the depressor septi nasi, so the name kind of gives away what it does. It depresses the nasal septum, so it draws the nose down inferiorly. So it actually inserts onto the nasal septum and it assists the alar part of the nasalis in widening the nostrils. So those are the three muscles of the nasal group of the facial muscles: the procerus, the nasalis, and the depressor nasi septi. So the next group of muscles is the oral group of muscles, and as you can see, there's quite a lot of muscles which make up this group. So if you're not interested in learning about all those in detail, then I'll just cover the two muscles that you need to know, and you can switch off after that, and then if you're interested you can carry on listening to find out about the other muscles. So what you need to know in the oral group, if you're only going to learn two muscles, is that there's this big muscle here which forms a circle around the mouth, and this is known as the orbicularis oris. So just like you've got the circular muscles around the eyes which constrict around the eyes, the orbicularis oculi, you've got the orbicularis oris. So in Latin, oculus is an eye, and oris is a mouth, so orifice, oris, help you to remember that. So orbicularis oris, this circular muscle which circles the mouth, and you can kind of guess what the function is. When it contracts, it narrows the mouth and closes the lips, so you get this pursing action which you get when you're whistling, and that's brought about by this muscle, the orbicularis oris. And the other muscle you'll need to know, which lies deep to these muscles here, is the